Hi, welcome to the Osteopathic Center podcast. Today, we're going to be talking about what are we? What is this place? And why would you even come here? So I'm the founder, Dr. Christopher Goddard. It began originally in 2009 in Tennessee and got the practice going in Miami roughly around 2011. And now we even have a Jupiter place. So we have Knoxville, Tennessee, Miami, Florida, and Jupiter, Florida. So this center is focused on regenerative and integrative medicine. Now, I like to break this down into a couple different categories. One is regenerative injections, more specifically non-surgical orthopedics. And then next is integrative medicine, for which we're going to go into some detail in just a few minutes about all the different aspects of what this entails. And then we have regenerative cosmetics. And of course, we'll go in detail for that, and sports medicine as well. And that does fall into a category of non-surgical orthopedics, but it's always good to know that sports medicine is, and we have to approach our patients as a patient upon their own, because it does require different types of healing and aggressiveness after our procedures than we would with our typical patients like myself. Okay, let's go into non-surgical orthopedics. What does this entail? It entails, anything from your typical things that you get at every doctor's office, like steroid shots, hyaluronic acid, whether it be from an injury, from the weekend warriors, or you did something at your house, or maybe it's your chronic degenerative changes like osteoarthritis and labrum degenerations and other things like that. And then we get into what this office really is and specializes in, and that's the regenerative component. And this is the ability in order to regrow tissue in your body, and regrowing ligament, tendon, joint, muscle. We can do it all. Now the key is figuring out if you're a candidate. Of course, you'd have to come in so we could do an exam and look at imaging and really find out if that's something that would be good for you. But the key is to know a little bit about the differences of what these are, because we have different types of regenerative treatments. The very basic and the oldest is prolotherapy. It's using chemicals in order to regenerate tissue. The most common one used around the world is dextrose solution, and it just creates an irritation in the tissue, and then that irritation causes your blood flow, and that blood flow causes your stem cells to come, and then you get regrowth of tissue. Generally, that treatment needs to be done multiple times in order to see an effectiveness. The next step up is platelet-rich plasma injections, also known as PRP. That's taking your own blood, and then we spin it down either once in order to concentrate platelets, but my preferred method is to spin it down twice to really concentrate the platelets and the growth factors that are in your blood. And when those are injected, creates inflammation, and that inflammation creates your stem cells to come to the area and heal and grow the injured tissue and resolve your pain. So then we get into what we call our stem cell therapy class. Now, this is a broad definition, and it's not what we used to think it was. Dr. Arnold Kaplan came up with the terminology in the 1990s. Just a couple years ago, he wrote another paper that said, these aren't really stem cells. They're medicinal signaling cells. So the evolution of what we know from a scientific aspect is changing, and it's very important to know that. So this class includes 5 different things. We have bone marrow from you, we have adipose from you, we have umbilical from somebody else, and we have amniotic from somebody else, and then we have what we call exosomes. And that's just a very broad definition of stem cell. Obviously, bone marrow is doing an aspiration procedure from the back of your pelvis and getting the best stuff that we can out of your body. And then we can re-inject that and help to heal the injured areas and tissue. Taking the adipose out is a small liposuction procedure, extremely small, very easy. Usually doesn't take 15 minutes, just like the bone marrow only takes about 15 minutes. We get a small amount, unless we're doing a lot of different areas, but a small amount is good for one area. We get that, and we can re-inject that. Then we get into the other products that are coming from somebody else, and they go through very thorough testing. They go through a 60-page consent forms. They make sure there's no disease states, and they go through the same guidance that if you ever had a grafting surgery, it is the same process that product goes through. So they are very safe, and they are very effective too. Now, I make a point to visit all the companies that we use in this office. Unfortunately, in the past, many years ago, there are companies that just blindly get these products and they have no idea where they're coming from, and they allowed the product to be infected. And so we are very observant and very cognizant of what can happen with this. And that gets into kind of my background when I was in undergrad, which I'll talk in the next podcast to give you an idea of how I even decided to build this company. But so what we have is the amniotic, which comes from amniotic fluid, as well as getting amniotic tissue. So there's two factors in this amniotic realm. In the tissue, when it's big enough to be seen in the syringe, it actually acts as a micrograft. So you're getting a twofold effect. You're getting cellular, as well as you're getting a grafting effect as a scaffold to build new tissue on. Now, umbilical, and more specifically, it's called Wharton's jelly because the cells are not in umbilical cord blood. They're in the Wharton's jelly, which is the squishy part of the umbilical cord. And they have to be gotten out of that, and then they get concentrated with the growth factors, and that way we can use those as a healing mechanism for tissue. The newest kid on the block, so to speak, is exosomes. So exosomes are the vesicles within these medicinal signaling cell. So they've developed techniques, the scientists, in order to take this out and concentrate it in the billions. So everybody thinks that this is where the field of medicine is going to go, but at this point in time, there's still a big mixture of using the medicinal signaling cells as well as the exosomes until we get more and more research on the whole field. And both of these, or I shouldn't say both, I should say all of these products I just spoke about will regrow tissue and then ultimately give you pain relief and give you improved function, help your sports injury to get you back on the field. If you want to go work out and you're having problems, we can get you back to working out. I've had people that got better within a day to a week, and I have people that it takes 6 to 12 months to get better. And of course, that comes with our evaluation in the office and looking at imaging and being able to tell if this is the right procedure for you. Now, one thing unique in our office that a lot of people do not do is diagnostic ultrasound. Myself, as well as Dr. Morse, have been specially trained with this, and that allows us to see in better detail the tendon, ligament, and even muscle than an MRI can because of how sensitive it is. And even more so, what can happen too, we can actually move the body in certain instances, and we can get a much better idea if the tissue is injured using dynamic motion with our diagnostic ultrasound. And then, of course, we use diagnostic ultrasound. I can use the ultrasound to actually guide our needle to the right place too. And that's the easy part. The diagnostics are much more difficult. It takes a lot more training to achieve. Okay, so that's the injection part, the non-surgical orthopedic part of this. Now let's move into the integrative medicine. So integrative medicine has such a broad meaning and many different levels and fields to it. You can learn this on your own at home. You can talk to nutritionists, you can talk to acupuncturists, you can talk to chiropractors, you can talk to doctors like me, anti-aging doctors. There's so many different ways you can come at integrative medicine. So I'm going to break it down for what I focus on here. First is osteopathic manipulative medicine. Now, there's many different ways to do this, many different ways manipulation is done. You can do what we call hard techniques that are if we get really technical, it's called a direct technique where we crack and pop you. But then we have our indirect techniques, soft techniques. The soft techniques are craniosacral and fascial. It could be neurofascial, myofascial, counter strain, those types of things. And I focus, as well as Dr. Kosubevsky up in Jupiter, he focuses on those soft techniques. And in those, you don't necessarily feel anything, but extremely effective. And but those are things that we can talk about through consult, or if you've had before, then we can talk about it. It tends to be very popular in Europe and on the west coast of the U.S. The next part of our integrative side is doing an evaluation and testing. So we always need the history from a patient. We have to find out how you're feeling. As many people have found out in the integrative world is that the testing that traditional doctors do doesn't always show what's causing your ailment, whether it be chronic fatigue, whether it be Lyme disease, whether it be autoimmune. There's so many different factors that typical medicine doesn't always pick up on. So we go into metabolic testing, go into toxicity testing, gut testing, heavy metal toxicity as well, in order to try to find out the cause. And if we can find the root cause, we have a much better and a focused plan on what we're going to be doing with you as a patient. Now, because there's so many people and you can read at home, and like I said, you can go to all kinds of different doctors and take supplements and do different things, I decided to get into the intravenous therapies. And these intravenous therapies focus on vitamins, high dose vitamin C, NAD, ozone blood therapy, ultraviolet blood therapy, chelation, and we have to use these in the right way for your particular condition. So it's just getting that initial assessment, figuring out what's going on in your body and what's going on with your life, really, and then we can tailor the treatment to what you need the most. Another part, the third part of our practice, is the regenerative cosmetic part. And this is focusing on hair, face, the P shot, the O shot, whether it be sexual health and skin health. We can use these same injections that we talked about earlier that were for sports and non-surgical orthopedics. We can use those in the area of the body to help regrow the tissue in the body. So if we, like I just, probably can't tell, but I just had my face done last week. And it's just trying to put the platelets and the stem cells or medicinal signaling cells into these areas to regrow our collagen. Our hair follicle, as long as we get it early enough and the hair follicle still exists, we can inject it and stimulate the growth of that. Make the diameter thicker, make some more hair grow out of that. Of course, for sexual health, we won't go into the details of that, but it's been very effective for both men and women. And then it's also been even effective for some disease processes such as Peyronie's, as well as for women, some incontinence, interstitial cystitis, chronic UTIs, and even painful intercourse. So the idea is using the same products we talked about earlier: platelet-rich plasma, bone marrow, adipose, umbilical, amniotic, exosomes, using it for the same purposes. It'll stimulate the growth. Wherever we inject these, it stimulates growth, in that only the growth of that tissue alone. Very safe and very effective. Now, the one I do like to point out in particular is sports medicine. So I've been doing regenerative sports medicine for almost 10 years at this point, and been fixing anything from, just some basic tendonitis, such as being the elbow, like your golfer's elbow, your tennis elbow, and going all the way up to helping labrum tears and severe meniscus tears, even severe tendon tears. As long as something's not torn 100%, we can help it, and I have helped it. And it's just coming in and figuring out if this is the right procedure for you. Now, getting into sports medicine as well, Dr. Morse is our and has a fellowship in sports medicine, and he joined the practice not too long ago. We're excited to have him and be involved in this journey as we move forward, because regenerative medicine is a journey, and it is going to continue to move forward as more and more people do it. He was even doing it in his fellowship program, whereas probably 5 years ago, nobody was. And so we're going to start seeing this type of medicine finally get involved in a lot of training programs where it wasn't before. So I'm excited to have Dr. Morse, Dr. Kosubevsky on board. In Tennessee, Robin Riddle is helping us with integrative medicine as a nurse practitioner, and look to keep growing and to keep adding to this field and growing in this field. And we're looking to serve you and give you the best possible care in the regenerative and integrative medical space. Thank you.